Practice of Cardiac Sonography 1, Lecture 6, Descriptive Report Writing. The contents of this lecture are 1. Preparing to perform an echocardiogram. 2. Entering patient information. 3. Qualitative information for the report. 4. Quantitative data for the report. And 5th, the report summary. Following this lecture, you'll be able to 1. Explain the importance of knowing the indication for an exam. 2. Describe the patient information that is needed on a written report. 3. To differentiate between qualitative and quantitative data. And 4. Define the key components of a report summary. Essential Echocardiography, Chapter 23. The reference for this lecture. Other sources that will be helpful are available via Views, the Western Sydney Echocardiography Reporting Protocol and Reference Values document. Preparation. Every echocardiogram should be done for a reason. If you aren't clear about the indication for the exam, seek clarification. The aim of every exam is similar. It's to provide an answer to a clinical question, that is, to the indication. Images are required, measurements are made, and an interpretation is given, guided by the indication. The report at the end of the exam should give details about the images and measurements and what they show in relation to the indication. Before commencing each exam, the sonographer needs to prepare. First, one should review the request form, which should state the reason for the examination. At times, the referral may not provide many details, so it's important to review any previous correspondence about the patient. If patient's records include previous reports and/or previous echoes, these should be reviewed prior to commencing the exam. Again, if you aren't clear about the reason for the exam, seek clarification. You all should be becoming familiar with the Year 1 examination sequence, with the view of developing a clear strategy for undertaking each exam. Upon reading a request, it's important to start thinking about which images and measurements you will need to pay particular attention to, or how the sequence may need to be modified slightly to ensure that all is done to answer the clinical question. Entering information. Correct and adequate patient details are very important. Incorrect details can mean that a report is assigned to the wrong patient. The information that should be entered into the ultrasound machine prior to commencing imaging and that should be part of the patient's report includes the patient name, date of birth and sex. A unique numerical identifier helps to ensure that patients with similar names can be identified and differentiated. The date on which the study was performed is important, as is the patient's height and weight. Heart rate and rhythm provide important information to medical staff, as does the indication for the exam. And confirming details with the patient is always worthwhile. Qualitative information. A report should include a brief quality statement. This may not be necessary if all images were of high quality. However, if they were poor, or if the exam is abbreviated for any reason, this should be reported. For example, if an exam was technically difficult post-stenotomy, For example, if the patient has had cardiopulmonary bypass operation, state that. Or if an exam is limited as the patient was supine and intubated or abbreviated due to urgency, state that. The images on this slide are an example of what you may encounter at times. The parasternal windows may give clear images, while images from the apical windows may be poor, or vice versa. In these cases, it's worthwhile to indicate what images were difficult and to provide the reason why. For example, technically difficult apical imaging post-mastectomy. Quantitative data. As you know, echocardiography is the most commonly used imaging modality in cardiology. One of the reasons for this is that it allows for the quantitation, that is, the measurement of cardiac chamber sizes and their function. Quantitative data should be an integral part of every report. Here are some 2D and Doppler measurements you are already familiar with, that is, those that we measured at the on-campus session. As you can appreciate, you're already familiar with how to make a number of valuable measurements. By now you should also be becoming familiar with the reference values for a number of measurements. Highlighted here with red stars are the values for linear LV measurements we made at the on-campus session, and those that can be derived from these are highlighted with blue stars. Other normal values you should be becoming familiar with are the 2D LVOT diameter and the mitral valve E and A wave ratio measured with pulse wave Doppler. Normal values for the velocities we measured and the valve area we calculated on campus should be values you commit to memory. And the upper limit of normal pulmonary artery systolic pressure measurement, which we didn't rehearse, but you've no doubt seen measured, is another one that's important to remember. Finally, a report summary. As a report often includes lots of information, patient information and indication, qualitative, quantitative data. It may include other comments. It should also include a summary. A summary should state the key findings of the report and should include an answer to the question or questions asked by the referring physician. Emphasize the important positive and negative findings, and where possible, compare findings with previous studies or reports. For example, imaging and measurements appear similar to previous studies or the previous study with the date provided. In conclusion, it's important to be clear about the indications for an exam. Correct patient information is essential. A report should include qualitative information and quantitative data, and a summary should state the key findings from the study.